Hi everyone, thanks for having me. As Rob says, I'm David McCreary, emergency physician at the Alfred, and I have a special interest in medical education. For the next 10 minutes or so, I'm going to talk to you about my experiences with virtual simulation and how I think that can be applied to global emergency care education. So when you think of medical education, you probably think of some variety of these fellas here. So anything from those low fidelity BLS mannequins that we'll all be used to the higher fidelity, all singing, all dancing, breathing, blinking, vomiting, SimMan simulators that we have at centers like the Center for Health Innovation at the Alfred. High fidelity simulation has become a regular feature in the training of emergency clinicians in the last 10 years or so, particularly for resuscitation scenarios where the education opportunities can be limited or impractical or even unsafe to do in the real world. Unfortunately, they're pretty expensive to set up and run, and that restricts their availability to those specialist centers, and that can really limit the access for clinicians in remote environments. So for me, in 2019, we started a master's module with Monash University on emergency medicine theory and practice. And the key learning opportunity from that is a one-week intensive that the students could do at the Alfred in person. And that would include masterclasses with our FACEMs, some online or some in-person assessments, and a high fidelity simulation day at the Center for Health Innovation, and that would be for resus and trauma simulations. Now, obviously, the world changed a little bit in March 2020, and we had to change the style of all of our content, and most of the intensive week was pretty amenable to that, in that we could provide the masterclasses and assessments online, but it's a bit more tricky when it comes to simulation. And we'd had a lot of feedback from the students that that was a really important learning opportunity for them. So I really wanted to find a way to do that. But how do you deliver simulation over Zoom? Well, it was going to have to be virtual. And unfortunately, the Star Trek holodeck doesn't exist. And that's probably the highest fidelity simulator you could probably get. When it comes to virtual simulation, it's been previously described, and it's basically just a form of distance simulation. And it could be anything from low fidelity to high fidelity, just like in-person simulation. On the lower fidelity end of things, you can have case discussions where the participants just talk through different points of a case as you go through. And that's what we do for our online tutorials anyway. On the higher end of fidelity, you can have things like a recorded video scenario with stop points where the participants can affect change and progress through the case. Or on the even higher fidelity end, you could have virtual reality where the participants could be immersed in this computer simulated medical environment. Now that can be prohibitively expensive, and when you look at the websites for any of these facilities, anywhere that lets you book a demo without telling you how much something costs is probably going to be out of your price range. It's that whole if you have to ask, you can't afford it thing. And unfortunately, a lot of them also require specific technology, whether it's VR goggles or some other piece of equipment, or a broadband internet connection better than you can even achieve in metropolitan Melbourne. So I thought to myself, okay, Dave, you're pretty techie. You should be able to solve this problem. And I sat down and brainstormed with one of our registrars, and we came up with some, I think, pretty good ideas, but they were admittedly quite complicated. And you'll be glad to know that that's not what I'm here to talk about today. Thankfully, before I went too far down that particular rabbit hole, one of our colleagues directed me to a resource that had been created by Sarah Fooey, who's an emergency physician based in Canada. So Sarah's solution to a very similar problem in their training program was to create the virtual resus room. So this is a free open access resource where students can participate in simulated scenarios and they interact with a virtual environment that is a Google slide set. And this is while they're communicating over video conferencing. So in general, that's going to be Zoom. Most of you will probably be familiar with Google Slides as a free online resource for the creation of presentations, similar to Microsoft PowerPoint or Apple Keynote. What you might be less familiar with is the collaborative function of Google Slides, and that lets multiple users interact and edit content and layout, and that content gets updated almost instantaneously on the slides, so everyone can see what's happening at the same time. So this allows participants to interact with a patient silhouette, the resus equipment and medications in real time, while the facilitator can interact and update the slides to alter the patient's vital signs and other factors. Then to slow the speed of simulation artifact that can be an issue even in real life simulation, the participants have to go to different drawers, identify and fetch medications or equipment, and then copy those into the resus room. And then they have to record in the notes any drugs, dose, route, things like that they give, and any updates of the actual scenario. The room also has things like defibrillators, ventilators, specialty drugs and advice, specialty procedures, and that can all be varied depending on whatever you can imagine and depending on the scenario itself. So this is a video clip of a brief resus on the virtual resus room, and I'm just going to talk you through it. So we connect the patient to the monitor and we see that he's a bit tachycardic. So we're going to check his SATs, and we see his SATs are a little bit on the low side. So we'll just add some high flow oxygen, dial it up to 10 liters. We'll check his blood pressure, and that's not looking too sharp either, but the SATs have improved a bit with the oxygen. We'll get some IV access and some bloods, and we're just typing in what bloods we need there. And we'll probably give him some fluids for that blood pressure. And so we'll copy those into the virtual resus room, and we'll check his, oh, look, he's got a temp of 38, so he's probably septic. We'll just do a chest x-ray, and yep, we've got nasty bilateral consolidation there. So some antibiotics maybe, yep, some Kef and a Zithro, that sounds reasonable. We'll copy those in and get them into the notes. And we're thinking sepsis, so let's just check a gas, and yeah, that lactate's not looking too sharp. So we'll recheck the blood pressure, still not great. So another liter of fluids, and after the 2 liters of fluids, heart rate's improving. Let's just check, your blood pressure looks better too. We'll check the urine output, and oh, it's gone terribly wrong. The patient's in DF. So let's just start CPR. We'll just say how we're going to do the CPR, get the pads on, and let's just go to our defib, get the defib turned on, and yep, that looks like BF to me. So let's just dial up some energy, and we'll pop back to, obviously we have to do safe defibrillation practice to get that oxygen away and get the hands off the chest. We'll shock. And success, the patient's back in sinus rhythm. Congratulations, high fives all round. Let's just get the oxygen back on. We'll recheck the patient, and it's probably time for an ICU referral. So I think our ICU doctor will hopefully appear any minute, and there he is. So we can tell him all about the scenario and discuss what we've done. So hopefully you'll agree it's pretty cool, but the main question is, does it actually work? And so the creators of the virtual resus room have helpfully recently published some research on this. They performed a program evaluation study on students that were using the virtual resus room, and they used surveys and a knowledge test, MCQs, pre and post session. They found that the vast majority of participants learned from the scenarios. They found it to be a useful tool, and they preferred it to the other types of online learning they'd had. And importantly, they found a significant improvement in the pre and post session MCQs. So the next question is, what about our procedures? What about the hands-on aspect of high fidelity simulation? Well, I ask you, are you really learning anything from the hands-on intubation part of a scenario? I would argue that for our purposes, practical skills are not what we're here to teach in emergency medicine simulation. Skills such as intubation, surgical airway, ICC insertion, they can be learned elsewhere, either clinically on the shop floor or on a specific procedures course, and ideally in a combination of both. Practical skills are only a real small part of what we do. And actually what we need to do is train our trainees to know when a procedure is indicated and then how to manage the team around it. So if we stick to the example of intubation, putting a plastic tube in a plastic hole is not what we're there to do in medical simulation. Rather, we want our trainees to know the indications for an ED RSI. We want them to know how to time it, so resuscitation before intubation and things like that. We want them to prepare for it, so the right drug choice, the right equipment choice, role allocation, using an airway checklist. And we want them to be able to recognize and have an algorithm for the complications. So you get your grade 4 airway, can't intubate, can't oxygenate, and you know that you're working towards a surgical airway and be able to describe how that's done. And that's all entirely achievable on a virtual simulation. So finally, we come to the question of what are the applications for the virtual resource room in global emergency care? Well, I'm hoping that you're all out there feeling inspired and plotting your own uses for it already. But since I'm the one giving the talk, I'm just going to share my thoughts. Excuse me. Our experience is that the virtual resource room provides a fully interactive, team-based access to medical simulation that can be supported and debriefed by expert faculty. And that can be regardless of your geographical location. And I think this is of particular benefit to clinicians in remote regions globally where they might have limited access to high fidelity in-person simulation because of availability and cost. And I see two main usage cases for it. The first is clinicians that are based anywhere and have local skilled faculty, but are maybe lacking sim equipment or space. The virtual resource room could be used in lieu of expensive software or equipment. The second is almost as an educational outreach. So clinicians in any center, whether it's metropolitan, regional, rural, overseas, can access specialty faculty at a centralized location. And it can be used as an educational outreach. And that's kind of how we're using it in the EMTP. And it allows trainees anywhere to have access to the same faculty and training as trainees in a major tertiary center. So I've also been in touch with Sarah Fui, who created the virtual resource room, to just see her thoughts on its applications. And she's told me that it's been used already in several international projects in Tanzania, Kenya, Uganda. It's being used for community and academic bridging education, particularly for pediatrics. It's been used in sim Olympics and contests, and it's been used for the education of a wide variety of providers, including nurse educators and paramedics. And so finally, I'll just leave you with some resources. First of all, registration will be opening soon for semester 1 of 2022 for our EMTP module. So if you'd like to join me on that. We also have financial support for low and middle income countries. So if you're interested, just get in touch either on our website or with me. If you're interested in using the virtual resource room, you can check out their website at virtualresourceroom.com, and they've got guidance on getting started and some building blocks. And if you just need some scenarios, you can have some ready-made peer-reviewed scenarios. There's tons available at emsimcases.com. And I think that is my time. So thank you very much.